What's up, guys? My name is Dr. Marco Lopez from the Basketball Doctors. I'm here with...
And Dr. Gabe Ignacio, also one of the co-founders of the Basketball Doctors. We're both doctors of physical therapy, co-founders of the Basketball Doctors, and we're here to start our first Q&A. We put out a post on our YouTube channel asking you guys to ask any questions regarding ACL surgery and rehab and anything related to it. It seems to be the most popular topic so far on our channel, so wanted to come here and answer some of the questions that you guys asked us. We're planning to do this more frequently. We just want to work through some kinks. We'll eventually do this live, I think. So first off, we just want to see how this goes, what type of questions we ask, and get some feedback as we kind of build this over time. But hope you guys enjoy it, and we'll pretty much just get into it.
Yeah, let's do it. So the first question asked was by username lblake11. This is a good question too. How do you load manage time on the basketball court? He's 14 months post-op ACL and meniscus surgery. He's been cleared from PT and completed the durability code program by Paul Fabritz. I've been hooping around 3 hours per week and want to wrap things up progressively and safely. What a good question. So Gabe, why don't you start it off for us?
Yeah, I mean, I think obviously he's done a good job with his rehab. We're usually around that 14th month mark. We expect someone to be at least like pretty darn close, or if not return to basketball. And there's a lot of tests that we do prior to someone getting to that point, but it sounds like he's done his due diligence. The fact that he's playing 3 hours of basketball is awesome. So it sounds like he did his proper rehab from start to end, and he's kind of in that return to sport, returning to his performance type of thing. So typically that's kind of the first thing. Did you do your ACL return to sport testing with a licensed healthcare provider? Have you gone through like the different strength tests to make sure you're appropriate, movement training, basketball return to sport training, which it seems like he has. And now it's like the ramp up, right? A lot of it's going to be based off tolerance, and the fact that he already has a baseline at three hours of basketball per session. Was that what he said?
Yeah, he's doing 3 hours a week.
3 hours a week. So typically what we try and do is we want to see, kind of like a follow-up question is, how much is he training per day, and like how many days out of the week? And we kind of track that, and like what does that look like? Is it all skills training? Is it shooting training? Is it live action? Is it practice? Is it like actually playing? So there's a lot of things you can mess around with, but just like giving you guys a number, we try to not progress someone more than like 10% load per week. Of course, it's hard to track that. Time is usually the easiest, and you combine that with the intensity of that training. So saying you're, I don't know if you guys know the RPE scale, like saying 10 is like the hardest workout you did, like feel like you're throwing up after, versus like a 1 is like you're just sitting and chilling, or like laying down, just even breathing. Yeah, so saying you do like 45 minutes of like intense like 3-on-3 basketball, and that you rate that like a 7 out of 10 or 8 out of 10, you'd multiply that by the amount of minutes that you worked and figure out a arbitrary number there. And then saying the next day or like 2 days later, you just do a shooting drill for like 60 minutes where you just work on getting shots up, some movement, things like that. You rate that like a 5 or 6 out of 10. Multiply the 5 or 6 out of 10 out of those 60 minutes, come up with another number. And that's a good way to kind of track load over a week, and then try and progress that week to week, so that you're doing it safely and kind of monitoring like how you feel after each session. So it's a lot of trial and error. It helps if you have like a strength conditioning coach or one of us, like a physical therapist, that can help you guide yourself on how to return safely. But generally that's kind of a good way to track if you don't have anyone helping you with that.
Yeah, no, and you mentioned a good question on a good point, on progressively overloading and seeing how you feel and how you progress, because another rule that we like to use is that soreness and swelling rule. And as Gabe mentioned, you first got to see how much intensity you have and everything, because if you ramp up the intensity too fast and you have swelling in the knee, that's a sign that you did too much too soon. That's a good quick sign, like, hey, that's too much. Another one is soreness more than 24 hours. I usually tell people 24 hours is okay, but if it's more, what do you think? It's a little bit too much, right?
Yeah, like 24 hours, kind of that sweet spot.
Yeah.
Maybe like keep it at that level, but if you're sore longer than that, you probably should back off.
So it's kind of, we have these external monitoring systems like Gabe mentioned. You have your RP and everything, and then you also have to have your internal. If you're sore, if there's swelling, that's going to limit the progression. And I think Gabe mentioned a big point is we got to make sure you're fully cleared. At 14 months, you want to make sure you've done all the tests. And we have a bunch of tests. Check out this link where we have some ACL tests. But you have to be doing these cutting drills, all these drills that get you back onto the basketball court. And you've been doing these movements in PT and everything. So when you're in the court, every movement's the same. And one question I would ask the user, Blake11, is how is he feeling? Like, is he able to do every move that he wants to do in the court? It's sometimes you go back to playing basketball and you're like, hey, I can't. One of the clients that I have, they can't pivot and play defense and open up just yet, but they return back to basketball. So that's one thing that would work on rehab, is working on that pivoting and opening up. So there's that return to play and there's return to performance. So, I think he's return to play, what did he say? Yeah, because performance is, you kind of ramp it up with more and more time.
Yeah, it's kind of like a good question because obviously you see a lot on like social media and stuff like that. People were like, oh, like when can I start playing basketball? Like the general term is like people say like 9 to 12 months or like 1 year. But that's like return to play. But then like returning performance, a lot of times we don't see people perform at their like best or like their prior level of injury until like maybe like their second season or second year. Good examples like Klay Thompson,
Jamal Murray.
Yeah, it's like their first year back, you kind of see they just don't look quite the same. The confidence isn't quite there. They're still a little bit favoring away from it. So return to performance is like a different battle, and unfortunately some people never really return back to that old level of play, and some people do. It's just every person's different, and you just have to kind of figure out what works for somebody.
Yeah, and just to piggyback on that, I think there's a cool stat, it's not good, but I think it's like 25% of people return back to performance. Only 50%, I think it's 56, return back to sports, but only 24% get back, or 25, but get back to that performance like Gabe mentioned, where they're optimally at the same level as they were before. And I think there's also new research favoring 2 years of rehab to go back to sport. So, people get cleared, but you still want to do that rehab, still progressive overload with a licensed physical therapist or a strength coach with the PT involved for up to 2 years, because you'll see like all those NBA players, they hit their peak at 2 years, and everyone says, at 2 years, my knee finally feels the same.
If like Marco, if you guys don't know, kind of the backbone of like why we started this was Marco actually tore his ACL. How long has it been now?
I think like 5 years.
5 years, and when he was like a year or two out, you could go into a little bit of like what your experience was like getting back into playing basketball,
Yeah, it's always the first year you trust it, but not, you don't really trust it, and then it's as you're playing more and more, you get used to it, and then you realize, oh, my leg needs to get a little stronger. So I think, like I said, the sweet spot, like Gabe mentioned, to play all the sports, it's around that 2 years where your knee's like, okay, I'm in tune with my knee. Because it's also, if you're playing sports, you got to trust your legs and feel in tune with your body. And I think that 2 year mark is a solid one. Like Gabe mentioned, all those NBA guys, Klay Thompson, Jamal Murray, they all hit their stride at 2 years. And then Porzingis, now he's actually doing well after his ACL.
Yeah, after his ACL. Kind of just last point to kind of round it all up. It's like, as you guys can tell from our conversation, that the ACL rehab like never really stops until you feel like you're back to your normal. And a lot of the rehab stuff that you do as you build up, as like things progress and you find out what your body needs, all that stuff, like all the rehab stuff and even like some of the strength stuff, you should continue to do. And like a lot of people that we work with, they use the exercise that we show them as like their warm-up or like their pre-routine to like playing a game or practices. Like you'll see it in the NBA if you go to warm-ups, they have all these type of bands. They're doing a lot of stability work, balance work, proprioception work. So there's just one thing to like keep with you as you get further and further along in your rehab and return to performance.
Yeah, great point. And it's like you do the rehab, then don't be scared, people, and like, oh man, I have to do rehab for the rest of my life. You do it, then you just maintain it, like Gabe said, as part of their warm-ups. And it's a long process, but you will get there. And just know that once you get it over with, everything else is easy. That way you're not thinking in the back of my mind, oh, my leg is still not strong, and that's going to affect you performance-wise.
Sweet. So obviously there's a bunch more that we can talk about that, but want to get to other questions. So the next question is from username Merrill Matthew 3836, and we're going to take it back to a little bit more of the early rehab. So he asked, do you recommend any exercises to do 7 to 9 weeks post-op ACL surgery? Use patellar tendon graft for the ACL. Marco?
Yeah, this is a hard question. Like Gabe mentioned, I kind of don't like timelines because we're more like goal oriented, because we don't know where, he or she's at that 7 to 9 weeks. But I'll kind of tell you what we would expect for sure by that 7 to 9 week. For sure, we want to have minimal swelling now. Hopefully the swelling is under control, because if there's still a lot of swelling, that means either one, the knee's under too much stress, maybe we're doing too much, or two, there's something underlying in the knee itself that it's not allowing it to recover. So first, let's calm the swelling down. But there's always going to be some minor swelling. We just don't want it to be too much swelling. Number two, we need to have full knee extension range of motion and hyperextension. So meaning that knee has to be as straight as the other knee, or almost as straight, but for sure past zero most of the time, right? What do you think? Okay.
Yeah, I think at that 7 to 9 week mark, you got to meet these milestones, and if you're not meeting those milestones, it's one where you have to take a step back or go slower to go further. Going fast isn't necessarily the best. Obviously, there's goals and things that you have to meet, but I wouldn't get too stressed at that 7 to 9 week mark if you're not hitting all these markers, but you got to make sure. That's why we're very much milestone and like goal oriented, because someone at 7 to 9 weeks can look so different from somebody else. To answer your question, full knee extension is huge. It's so important.
Yeah, especially at 7 weeks, because in 7 weeks, 9 weeks, like I said, usually, especially when you're working with us in the beginning, we're probably off crutches 100% by then, most of the time. And then we're walking with their knees straight. So we'll kind of say ideal scenario we look for, knee is straight, they're walking with almost no limp. And we're starting to do some strengthening exercises, but they also depends on the graft. I know they mentioned patellar tendon graft. So with the patellar tendon graft, as you guys know, they get a piece of your patellar tendon and your kneecap. So now you're more susceptible to patellar tendonitis if you progress it too fast, too soon. And sometimes people have a lot of pain there. So that's where, like Gabe said, sometimes you got to slow down to go further, because we don't want to go too fast and all right, let's start doing squats and all these single leg squats or anything else, that we start irritating that patellar tendon and you have patellar tendonitis or /tendinopathy, and that prevents you from fully getting your quad strong, because it hurts every time you do some quad exercises. So in regards to strengthening exercises for those, I mean, everyone's gonna look different, but ideally the 7 to 9 weeks, we're really kind of bumping up that strength to start getting ready for those jumping and running phases. What do you think? What's one exercise? It's so hard.
Yeah, for just one exercise. But yeah, I mean, with that patellar tendon graft, you want to really make sure your quad firing is solid, and that's why having your knee straight and have minimal swelling is important, because having that allows you to fire your quad better. You're probably at the point now where you're hopefully doing some like functional training, whether it be like partial squats, really working on gait training, maybe like some wall sits or something like that, straight leg raises. But one thing that you have to know at the 7 to 9 week mark is that graft and your knee is probably the most vulnerable at this stage. It's kind of where tears happen most frequently when they do happen. Obviously it doesn't happen often, but it's in this 7 to 9 week time frame, because how the graft pretty much becomes a ligament. Pretty much the ligament was a live tissue because it was your tendon, and the tendon essentially dies and revascularizes, so that it's very vulnerable at this state. So you really want to make sure you're not doing you don't want to do really any like open chain stuff. We do open chain exercise, but it's not truly open chain, because like a more classic one is like the long arc quad or like leg extension machine. It looks like an open chain exercise, but it's not, because you're pushing against a like a force or an object.
Yep.
And with us, we'll probably be doing like some type of isometrics in a safe range type of thing. So it is something to be cautious about. Doesn't happen often, but if it were to happen at an early stage of rehab, this is probably the time frame that it would.
Yeah, I know. And there's some people that, you know, at that 9 week mark, you feel really good because you're walking without a crutches. You're like, damn, I'm on top of the world because I'm doing so well. And then it's when you start getting risky and start being like, hey, I'm going to jog across the street to catch this light, or, you know, do this turn, this pivot. And that's where we kind of get in those re-tear situations. Like Gabe mentioned, that graft is very susceptible, and people generally at that week 7 or week 9, even to like that week 12, feel really good, and they're like, hey, I think I could do this, I should be able to do this. But that's when we have those re-tears. Yeah, I mean, I think that's it. I mean, it's a hard question to answer, but I think if you have those goals in mind, getting that knee straight, having minimal swelling, bending, honestly, I'm like a 90-85% bending in the other leg. I mean, we could always get bending. Like, once you get past 125, what do you think? That's pretty easy.
Yeah, I mean, you have milestones with knee bending, like getting 60 degrees, 90 degrees, 110, 120. It's like, as long as you're making steady progress, that's all you need with knee flexion. You don't need to force it. We've seen people that just naturally comes along with time and continued work. Obviously, you need to work to get it, but I wouldn't be too concerned if you don't have full.
Yeah, just get past 90. Because if you don't get past 90 at week 7, then you're a candidate for that manipulation under anesthesia, because your knee's just super stiff. Could be a cyclops lesion in there. But just get past 90 for sure. Ideally that 110, 115, 120. But it's, I mean, the knee extension is the hardest. You know, if you don't get it early on, can't activate the quads, can't do anything. That's why we stress getting that knee as straight as you can early on. That way everything else is super easy. No, that was a good question. Anything to add on that, or?
No, like it's kind of what we mentioned. Just we'd love to give you exercises. Just we'd be doing a disservice by putting a generic program out there that would be like, you need to be doing this at 7 to 9 weeks. It's unfair for people. Yeah. And like you could be way ahead or way behind it. So there's things that you should be working on for sure. So I hope we covered that at least. Yeah,
we'll make a video. I think I like this question. We'll make some videos on like targeting certain muscle groups during ACL rehab. Like, hey, targeting the quads, early rehab, ACL, targeting hamstrings. I like that. I think that would be more beneficial. That way you know, like, hey, if I could do this, this is level 1, level 2. So actually stay tuned. That's a good video that we're going to probably post up soon. Let's move on to the next question. I think it's the same user. Merrill Matthew 3836. This is a really good question. Why do you think Klay Thompson and now Tim Patrick from the Denver Broncos tore their Achilles following an ACL injury, and how can you avoid it from happening?
Yeah, I mean, it's like you hear about them and like we've learned about it in school, and like we've fortunately haven't seen it in the clinic, but we can see how things like that can happen, especially with the level that they play. Like these guys are professionals and they're like tip-top athletes. They're not playing at like your rec center or anything like that. They're playing against like top-tier athletes, and obviously Klay Thompson tore his Achilles at like a open gym run against NBA players. But to get to the question, majority of the time you see it on the contralateral opposite leg, right? So I think both of them were opposite sides, right?
It was Klay Thompson left ACL, right Achilles. Tim Patrick right ACL, left Achilles.
Yeah. So I mean, it's hard to say like what happened with the rehab and like how to avoid it completely, but things that we want to see or things that you can typically see when people return to sport, especially if they're trying to return quickly. A lot of times these top tier athletes are trying to get back as soon as possible, is that either they had a quad deficiency or single leg strength deficiency on their ACL side, and like when they do running, they slowly and like subconsciously favor their other side. And then what tends to happen is that you stop and go a lot more on that opposite side. You tend, when you run or decel or jump, you tend to jump a little bit more on that opposite side. It probably got to a point when he probably felt stiff and tightness through that area, whether he recognized it or not. And a lot of times you don't have Achilles tendon tears without something leading up to it. Yeah. It's like that tendon is strong.
It's the strongest tendon in our body.
Yeah. So for that to happen, there had to have been like chronic tearing or like degeneration of that tendon where it got thicker and thicker. And when you probably accelerate or change direction, that thing just blew when that happened. So a lot of times it's still persistent deficits on the ACL reconstructed side and overcompensation from the contralateral side.
Yeah, I think Gabe mentioned a good point on whenever you're pushing off, and I've seen this a lot with ACL patients, you're having them dribble or they stop and then push off again, they're going to start favoring their opposite leg. So imagine that increased load, now going back to the first question, on that left leg or that opposite. So if it's your right ACL, you start pushing off using that negative step with your left leg. So you're constantly pushing with that left Achilles, and then that just over time just gets overloaded and it leads to that tear. Tightness, you'll feel some issues, and then over time, and it normally happens. I believe with Klay Thompson, it happened right when he started getting back to basketball. Yeah. Tim Patrick, I think, was the same thing first couple weeks. And have you noticed in the NFL, all these Achilles tendon tears and sometimes ACL tears, but mostly Achilles tendon, they all happen within the first 2 weeks of the NFL season, including preseason. It's just that ramp up time and you're not ready for it. And like you said, for ACL, it's a long process. And if you're not trusting that ACL leg, you're going to start loading that opposite leg. And sometimes I think that gets often underlooked is people strengthening the calf and the soleus muscle, doing little pogo, jumps, jump rope, just getting those tendons stronger on both sides. Because we get so focused on the quad, the hamstring, the glute, that if we forget the foot structure, and that plays a huge role in coming to ground contact and pushing off. But I think it's the mixture of, one, not being prepared for the demands of the sport, or two, is that you're still not fully recovered from that previous injury. That's what I think.
Yeah, and I think going back to the first question that was asked of how do you load manage as you return to sport and return to performance, that whole thing of making sure you're tracking how much load you're actually putting into your leg, awareness of that, seeing how your body feels, actually reflecting on not only the leg that got reconstructed but also your entire body. You got to be smart and think about yourself as a whole. Obviously, he just mentioned it, we get, not only as the athlete but as healthcare providers, sometimes people get tunnel vision and only want to do that side. And when you work with us, you'll know from the get-go, especially lower body injuries, we're big on the foot and ankle. It's your first point of ground contact and everything translates up. So if you're not doing anything at the foot and ankle when you have a knee or hip or spine issue, then you might be missing a whole thing, and that might be the source of your problem, not actually coming from where you're having the pain. Obviously ACL reconstruction is different because that is exactly what you're needing to work on, but working on your foot and ankle and all that stuff, and doing tendon rehab and tendon strengthening and support, we do that regardless. So just something not to overlook, what Marco mentioned.
No, 100%. And I think, like I said, we'll always kind of see, unfortunately, issues pop up like this. But that way, if you feel this issue, don't be scared. Now you just got to make sure, because you're aware of it, I'm feeling some Achilles tendon tightness. I got to address it, as opposed to just pushing through it. Those are kind of the risky. And also Achilles tendon tears are most common with later 20s, early 30s, right? That's the sweet spot.
The sweet spot, yeah.
For athletes.
Yeah, and I think just coming from a PT's perspective and working with professional athletes all the time, I the relationship you have with an athlete and their relationship with you makes a huge difference, because athletes tend to hide injuries and they try their best not to show it. But if you have a good relationship, you should discuss that with your healthcare provider, your athletic trainer, your physical therapist that you're working with, because we're not mind readers just like anybody. We can only do so much in a session, that if we don't know that's what's going on, I'm sure whoever was working with Klay Thompson would have for sure addressed it. They just like probably unaware of what was going on. Like, not saying Klay Thompson was aware, but it's just like, yeah, it's just one of those where something got overlooked, and unfortunately things happen like that. Freak accidents happen. So yeah. Okay, moving on.
So that wraps up with our part 1 of our ACL Q&A questions. So if you guys like the content that we just went over, and if you have any questions, just comment below. But if you want to learn more about our part 2, which is an include on some of the factors that we choose on selecting a surgeon for the surgery, and is cracking / popping normal after ACL surgery. So if you want to learn more about that, click the part 2 link here.
And yeah, guys, just so that you guys know, sorry for the abrupt ending to our part 1. We shot it all in one part, but we didn't know that our camera would stop recording after a certain amount of time. So we got to reshoot the other questions, and that'll be in part 2. Like Marco mentioned, if you enjoyed what we're putting out so far, please comment or like and subscribe and go over to part 2. If not, and you got what you wanted out of it and you have more questions, please let us know down below what other questions you have for us, and we'll go from there. But yeah, see you guys in part 2.